The following program, Live and Learn, is made possible by Aging Partners. Find out more on their website at agingpartners@lincoln.ne.gov.
Welcome to a special 1-hour Live and Learn feature program on Alzheimer's disease. This is a dreaded diagnosis, as the disease has no known cause or cure. According to the CDC, it currently affects more than 5 million Americans and is projected to rise to 16 million by the year 2050. As stated by the Alzheimer's Association, Americans will spend $236 billion this year in healthcare costs related to this disease. Research is underway to find diagnostic techniques to help affected individuals early in the disease process before the irreversible dementia occurs. I'm Kristen Stowes. In the following 4 Live and Learn segments, we not only get the facts and figures of Alzheimer's disease, but also hear from caregivers about their personal journeys in caring for their afflicted loved ones. Please stay with me as we learn about the long goodbye that is Alzheimer's disease. Alzheimer's disease, a difficult diagnosis to receive, not only for the patient, but also for family and friends who are caregivers. I'm Kristen Stowes, and I am pleased to have Natalie Leon from the Nebraska chapter of the Alzheimer's Association. Welcome, Natalie.
Thank you.
So glad you could be here today.
Thank you for having me.
Absolutely. I understand your interest in working with Alzheimer's disease has developed over a period of years. Tell us a little bit of the history there.
Well, I actually started in high school, and I've been in healthcare for over 10 years now. I started off as a CNA and medication aide, and my first job was working in an Alzheimer's unit. And that was the first time I've ever been experienced to the disease. And I was just really intrigued about the disease and the effects on the brain. And I really enjoyed working with the patients and the caregivers.
That's wonderful. So you're working with a passion.
Yes.
And I like that a lot. Could you please define Alzheimer's disease for us?
Yeah. So Alzheimer's disease is a form of dementia. It is the most common form of dementia, which makes up 60 to 80% of all cases. So over 5.3 million people have Alzheimer's disease in the United States alone. And what Alzheimer's means is that it's a brain disease that causes issues with memory, thinking, and behavior. It is a progressive disease, which means it gradually gets worse over time. So every 67 seconds, someone is diagnosed with Alzheimer's disease.
Really?
And Alzheimer's has no cure, no prevention, or slowdown. So it is fatal.
Oh, it's devastating. It truly is. What is the typical age that symptoms first appear?
Well, your greatest risk factor is age. And so 1 out of 9 over the age of 65 develop this disease. And then it goes to 1 out of 3 over the age of 85. So you can clearly see it's an age-related disease. Now, women do have a higher chance of developing Alzheimer's disease because we tend to live longer. However, men are starting to close that gap.
Okay, those are important facts to know. Do we really know what causes Alzheimer's disease?
Well, what scientists know is that Alzheimer's involves progressive brain failure. And why these cells die off or fail, we're not really quite sure. But what we do know is that these brain cells lose communication and they lose their ability to do their job. So they end up dying off, and that's what causes the shrinkage of the brain. And what we also know is Alzheimer's is not a normal part of aging.
And that is important to remember. There are some myths about Alzheimer's disease. Can you talk about a couple of those?
Sure. One myth is only older people get Alzheimer's disease. There is a younger onset Alzheimer's disease, and that usually starts under the age of 65. And what we know about younger onset, it is more rapid, and so their life expectancy is more shorter than the later onset, which is 65 or above. Another myth is that treatments will help slow down the disease progression, and that's not accurate. What they do is they can actually help mental clarity for a year to a year and a half, but after that it just levels off, and they help maintain whatever stage they are in the disease process.
I see.
Even though the disease still continues on, so you still see that decline, but it helps them maintain at the highest level.
I see, okay. We are going to put on screen the 10 signs of early detection for Alzheimer's disease, and I believe you will comment on each one of those for us.
Yes, so the most common early symptom for Alzheimer's disease is difficulty remembering newly learned information. And so your first warning sign is memory loss that disrupts daily life. So that's a big indicator. Another one is rapidly or repeatedly asking the same questions over and over again.
Okay.
Number 2, challenges in planning or solving problems. Here, it's usually they're taking longer to do those activities, which kind of leads into difficulty completing familiar tasks at home or work. It's something that's taking them longer. Usually it would take them only 30 minutes, is now taking 3 to 4 hours.
So it's a definite change.
Yes, absolutely. The 4th is confusion with place or time.
Okay.
So here they lose a sense of time. And the biggest one is, seasons of time. It starts going to years after that. And so that's a big indicator as well. Trouble with understanding visual images and spatial relationships. Here, this is usually affected by or driving is usually affected at this point.
I'm sure.
And
yes.
I've had caregivers say, my loved one doesn't know what color to stop at a stoplight. And so they'll just stop at every stoplight because they don't remember if it's red or if it's yellow or if it's green that they have to stop. So new problems with words in speaking and or writing. So here it could be calling something the wrong name, like a watch is a hand clock. They're not able to make that distinction anymore. Misplacing things or losing the ability to trace steps. The last part of this, the retrace steps, is the biggest one. When we lose something, we're able to recall the steps that we have taken. But for somebody who has Alzheimer's disease, they're not able to recall that. And so this is where you see them really talk about accusing people of stealing things or maybe misplacing things because they honestly can't remember that they ended up setting it somewhere differently.
And in the misplacing of things, everybody misplaces things.
Absolutely.
But is it more that if you end up finding this item someplace that it really should not belong, like your reading glasses are in the freezer, that this is a real disconnect then?
Yeah, absolutely. And it has to deal with retracing your steps. If you had something in your hands and set that down, not really thinking about what you had in your hands, you're just trying to free them up and then later come back and say, oh my goodness, I remember I put this here. That's the biggest distinction, is the recall.
Okay.
Decreased or poor judgment. Here you can see whether it's large sum of money going to telemarketers. That's a big indication, is misplace of financial funds can be an indicator. Withdraw from work or spatial or social activities. Some people are able to realize that there is something wrong, and so you'll see that withdraw because they don't want to see, they don't want others to see that there's an issue. And then the last one is changes in mood and personality. This disease is 80% behaviors, so you'll see a lot of different personality changes, whether it's confusion, anxious, or suspicious. You'll start to see an element of different emotions.
And some of these signs the patient can probably recognize in themselves, whereas some of them maybe it will take someone else to see it in the patient.
Well,
is this true?
It really depends on the individual.
Okay.
The saying is, if you know somebody with Alzheimer's disease, you only know one person with Alzheimer's disease, and each person is a little bit different. And some people are aware that they do have memory issues, and then others do not. And it really, plays a fact of where they are in the disease process
Yes,
too.
certainly, I can understand that. Why is early detection and diagnosis important?
Well, with any diagnosis, early treatment is better, no matter what it is. And so it's really important to make sure that you get an accurate diagnosis and start that early treatment. And for Alzheimer's disease, it's really about planning, making sure what your journey ahead looks like and making sure you have all those parts in place.
And for an Alzheimer's patient, doing that early is paramount.
Yes, absolutely. The
able to
earlier
tell.
in the disease process, they're able to really
Look ahead for themselves.
look ahead and participate with their family members
Yes.
and kind of voice what they
That
would
would
like
be
to
very
see.
important. Let's talk a little bit about the patient evaluation and assessment.
Sure.
Where should someone start if they're thinking they might have Alzheimer's signs?
Well, there's no single test that determines Alzheimer's disease. It is a rule-out disease. And so the first step is going to your primary care physician. From there, they can do some testing, but they usually will refer you on to a neurologist or a geriatrician to get further testing done. And what they tend to look at is a multitude of different elements. And so it's really vital to make sure you have all of those pieces in place. So the first area that they look at is your medical history. They look at the individual's medical history to see if they have any heart disease, because heart disease actually does play an effect. If you have high blood pressure, high cholesterol, stroke, diabetes, it gives you a higher risk for developing Alzheimer's disease, because you have to think of it, your brain and heart have a huge connection between the two. And if your heart has some implications on it, it's going to have some implications on your brain, because your brain is being nourished by your heart.
Makes sense.
And so another element is a mental status exam. So here is usually the mini mental. They do a lot of mathematics, word problems, and that's only used as a baseline. It really is to get a good grasp of where the patient is at that time. It should not be the only test that a physician does. And a physical is another part. Here they're looking at, is it something that's causing these memory problems? Is it something that's treatable? Like certain infections can cause memory issues, like a urinary tract infection or pneumonia. Also, vitamin deficiencies can play a huge role.
And wouldn't it be a huge relief to hear that it is something that can actually be fixed?
Yeah,
and
absolutely.
It's not Alzheimer's at all.
Absolutely.
Yes.
It's almost a no-brainer. Why
Yes,
not?
absolutely.
But also, if you have two medicines that are not supposed to be used with each other, that can cause some cognitive memory issues as well.
Very good.
Another element is a psychiatric evaluation, where they look at mental disorders. Is there depression that's going on? Because depression can actually mimic the symptoms of Alzheimer's disease. And once you get on the proper medication, a lot of those mental clarities can be fixed. And then neurological is the last piece. They're looking at, not only a scan of the brain, which usually is an MRI, to see is there a brain tumor, is there fluid in the brain that's causing these issues. They also look at your nervous system.
So there's many pieces of the puzzle here.
Yes.
And it's important to be diagnosed by a physician to the correct form of dementia or not, which would be what you would want to hear. Is there hopeful research being done?
Absolutely. All of our research is really geared towards prevention, and that stems from the heart disease, all the research that has been done there. They know, what we know now is if we can prevent a stroke from happening or a heart attack from happening, that damage that has been done, it's so hard to reverse those effects on the damage that has been done to whether it's the heart or the brain. So we know if we can prevent it, the better. And so that's exactly what Alzheimer's research is going towards, is can we prevent somebody from getting this disease or at least slow it down? And so it's really interesting the different types of research that is going on
Good.
in that
Well, that's
area.
wonderful to hear. That's very hopeful. Just a quick word, how important is good nutrition, good exercise, good sleeping habits in controlling symptoms?
Yes, absolutely. So physical exercise, that is number one. If you don't do any of the others, that is actually extremely key to making sure that you keep a healthy brain. Along with diet. Diet is very much important. Making sure that you are taking care of your body. Social engagement is another piece.
That's huge, I know.
Yes, a lot of elderly don't get that. That's missing out of their realm, and so they need to make sure that they are mentally stimulated as well as socially stimulated.
Yes, I understand. Well, I'm sorry, Natalie, our time is at an end, so we are going to be putting on screen the Alzheimer's hotline number. 24/7 people can call with questions or crisis situations.
Yes, yep, it will get you to a medical staff, a medical licensed staff, and they can help you if you're in a crisis, if you have a question, you know, if something comes up at 2 a.m., they would be the person to call.
Oh, it's wonderful to know that you are there.
Yeah.
And thank you for being with us today, and thank you for helping so many people who are battling this disease.
Well, thank you for having me.
Absolutely. I am going to continue to explore the subject of Alzheimer's disease and will concentrate on caregiving in future segments. Please watch for those, and always remember, it's never too late to live and learn. Welcome to a special segment on Alzheimer's disease. Please watch and listen.
Lament on a wide expanse of plain. The morning of a bad day, sadness seems to reach to the horizon and beyond. No soft rise or hill or mesa or butte can dam it. It fills every rut, every gully. It spreads over rocks, around fence posts, under brush and leaves, and purposefully, like a spring flood rising, it flattens every surface feature from here to the ends of the earth. No forecast can say when it will retreat and puddle and leave dry ground enough that flowers might sprout again, then bloom. It just sits here, formless, stagnant, gray, resolute. There's no plug to pull to drain it. It reflects a sullen sky and resists any natural tendency to evaporate.
These are the words and works of my guest, Michael James, professor, textile artist, poet, and caregiver. Michael, thank you so much for being here today.
Nice to be here, Kristen.
Good. Your quilt creations and your poetry tell your story as a caregiver for your late wife, Judy. As we look at the beautiful quilt entitled Lament on a Wide Expanse of Plain, could you please elaborate on its meaning?
Well, the diagnosis of younger onset Alzheimer's intruded on our lives in 2009. And I think we both felt kind of out at sea in a way. And the quilt is a little bit of a visual analog to that space that we were suddenly in, one where we felt we were adrift. We had no boundaries to connect with. But the flip side of that is that it also kind of represents the landscape of this part of the country, which gave us a sense of being grounded, and the enormous skies and the broad horizon here gave a sense of hope and optimism despite the realities of the diagnosis.
Beautifully represented. Very, very beautiful. Please tell us a little bit about your background.
Well, I was an art major in art school many years ago and studied painting and printmaking, and after I got my degrees, I found my way into the world of textiles and specifically quilts. And for about 25 years, I worked as a self-employed studio artist making quilts, and I built a career around that. And that's what eventually brought me to Nebraska.
And yet that profession certainly took a backseat to your role as caregiver for your late wife, Judy, as she developed her Alzheimer's disease. Please tell us about Judy.
Well, she also is a textile person. We met in undergraduate school. We married while I was in graduate school, and we have been married for 43 years, together for 44. We have one son who's that age, and she had always sewn from when she was very little. So my adopting quilts around the time that we got married was in part a strategy to endear myself to her, but also because the materials were around and and interesting. She also owned a fabric store for many years and was in the home sewing retail business.
You were a wonderful team, sounds like to me. Judy's diagnosis was in 2009, but in retrospect, you said that you could see symptoms of Alzheimer's much earlier than that. What were some of her early symptoms?
Well, there were, and when I think back to the very first, I call them disjunctions. That I didn't know that they were symptoms because I had no label for and no experience with any kind of cognitive impairment. But they were just disconnects, something that she would say or something that she would repeat or just odd things that felt wrong.
Yeah, right.
But early in the, around the time of her diagnosis, I can think of one incident that's kind of really illustrates what was going on. She packed up her car with our recyclables to take to the recycled deposit center and went out the door. And after 10 or 15 minutes, I heard a noise in the garage, and I thought, oh, she must be back. So I opened the garage door, and she's sitting in the garage. The door is closed, and I said, did you just get back? And she said, no, I haven't been. I can't open the door. And she had forgotten where in the car the garage door opener was. And that was just,
So that told you something big
yeah,
then.
Yeah,
Yes,
for
yes.
sure.
Did Judy herself understand in the beginning what was happening?
She knew that there was something wrong, no
Okay.
question.
She could recognize that.
But she, like me, had no experience with this disease that we think there was a familial connection now in retrospect, but it was masked and we never really, and undiagnosed. So.
Yes. Well, let's take a look at another one of your quilts. Please tell us about this one.
This is a piece called For Now We See Through a Glass Darkly, and many people will recognize that title as a line from Corinthians, Paul writing, and I appropriated it, but with a slightly different meaning, because the biblical meaning of glass had to do with mirrors, actually.
Oh, okay.
And I actually have used some fractured glass pieces in this,
Really?
In the textiles. They're digitally developed and digitally printed textiles, because at that point in time, our lives were really fractured, almost like somebody had smashed glass. And just after her diagnosis, less than a month later, our home here in Lincoln was broken into.
Oh, really?
And the perpetrators went through a big plate glass window.
Oh.
And that became a kind of metaphor for the disease breaking into our lives at the same time.
That's a very appropriate metaphor,
Yeah.
yes, absolutely. After Judy's diagnosis and her disease progressed, you became her caregiver at home for approximately 6 years. Do you have some tips or suggestions for others that might be facing similar circumstances?
Well, I want to just clarify one thing, and that was I was her caregiver, but I was also, through that whole time, employed full-time here at the university. So I was working a full-time job and and managing
It's mind-boggling,
as best I
to be
could.
honest, yes.
And eventually I did hire professional caregivers to come in and spend time with her. But one thing I learned, and I think probably the single most important piece of advice I could give anyone who's facing this, is as soon as possible, learn how to be in the moment. Because the person with the disease will gradually, the past will disappear, there will be no future, they become totally fixed in the moment, and you have to be there with them. And that was one of the things that I wish I had learned sooner.
Yes,
Yeah.
you want to make a good day the best day.
Yeah,
Yes,
exactly.
I can understand that. And also, you just need to realize that the person isn't responsible, and never be mad at the person. It's the disease that,
Totally.
that you have to
Yeah.
have.
Yeah, and you
Yes.
learn to tell yourself that it's the disease, it's not him or her.
And I know you continued to take Judy out. You went traveling some. Did that help?
Yeah, we did quite a few long road trips, which we
Okay.
enjoyed because we could sort of leave the disease at home, at least more or less, and we love these wide open spaces in this part of the country, and as I said earlier, it kind of gave us a sense of being connected to
Yes.
place,
Yes.
and that was comforting.
So at some point, you decided to bring in home health.
Mm-hmm.
And then that really allowed your creative process to flourish because you then had some time. Is that correct? To think about it.
For the first few years after a diagnosis, my creative work got kind of put aside. Frankly, I didn't have much enthusiasm nor inspiration.
Right.
And I hadn't quite figured out how I could even use it. But over time, I started to see that there was possibilities in that work
Okay.
to address a lot of the feelings I was having and that she was experiencing. And so I eventually found my way back into the studio in a very productive
And you were able to
way.
create 14 quilts
Yeah,
in a
in a
period of
2-year
about, in 2
2-year
years,
period,
which
exactly,
seems like
2-year
lightning
period.
speed to me.
I have a studio assistant, so she
Okay.
makes that possible.
Tell me, did Judy see these quilts?
Yeah, she was very much a part of that process because she'd come down to my studio as I was, working on a piece, and she still understood. She totally understood what I did because she too was a textile artist, and
Sure.
she would give me feedback, and she recognized the development of these pieces.
I believe we have one last quilt called Elegy Flatland.
Nope, this is actually next, then after.
Oh, okay. I'm sorry, I've skipped one.
Yeah.
Okay.
And this one is a kind of expression of the sort of almost schizophrenic day-to-day that kept getting more unmanageable
Yes, chaotic, I'm
as
sure.
the disease progressed.
All right.
And so it sort of is a portrait of the caregiver.
I see.
On a
Okay.
bad day.
All right. Well, let's quickly move on then to Elegy Flatland, which I believe is the last quilt that we will be able to talk about today.
Elegy Flatland was actually the last piece in the series, and
Okay.
it is an elegy for the whole. In our case, it was a 6-year process from diagnosis till Judy's death, and it uses the landscape motif in part, but it also has a panel that I intended to kind of depict the disease itself, the fracturing of all these neurons, these connections of neurons in the brain, which is what the Alzheimer's and dementia processes do inside the brain.
Michael, I know while the disease process itself is so sobering, were there some positive moments that you now look back on and treasure?
Well, we had a lot of wonderful times. We still enjoyed the things that we had always enjoyed: music, film, and although over time her ability to follow storylines, for example, in a television program or a movie, decreased, we still could do those things that we had always done together and find enjoyment in them.
Can you give one quick tip from your experience? What is the most helpful form of assistance friends and family can offer?
Well, I think that the gift is as much to the caregiver as to the patient. And I think that offering the gift of time to a caregiver, offering to take the person out for an afternoon, or to go for a walk, or to come over and spend a couple of hours looking at photos, or doing a simple playing a simple game, or anything like that that will give the caregiver a respite, 2 hours where they can run to the gym, or go out and see a movie without being
The gift of time is wonderful, and I wish we had that gift right now, but I'm afraid our time is drawing close here. I thank you so much for being here today, Michael, and sharing your very personal story with us.
Thank you.
We are closing with one last picture of this remarkable couple, Michael and the late Judy James. It has been an honor to tell their story to you today. What are the qualities needed to be a caregiver for someone with Alzheimer's disease? Compassion, patience, stamina. We will learn that it takes all of that and so much more as I welcome Lee Nyberg from Home Care Assistance. So glad to have you here today.
Thank you. It's great to be here.
Wonderful. Could you please tell us what brought you into the caregiving arena?
Sure. My background's in marketing and strategy, and I came to this business because I was taking care of my parents long distance in Georgia, and they had great caregivers, but they needed training and supervision, and so that led us to creating Home Care Assistance.
Wonderful. So you have come to it with a passion, and I like that.
Yes.
Although this is my third segment on Alzheimer's disease, I think it is really important to start our conversation by stressing that Alzheimer's is more than just memory loss. Let's look at a graphic as you address the many issues that encompass Alzheimer's disease.
Okay. Alzheimer's is a form of dementia. It's the most common form, as you know, and I'm sure most people are aware. And there are many more issues, though, than just short-term memory that are affected. While memory and short-term memory is the first thing that comes to mind for most people, and it's also the first thing people seem to at least be noticeably experiencing. There's also executive function that's affected, and this is an area that we all use to plan and complete tasks. And so when you see this in someone who's affected by dementia, you see them being unable to organize, unable to do very simple tasks, like even something so simple as making change they can't do anymore. Attention is another thing. This is something that we use to put information into our memory filing cabinet, but if you can't pay attention to something long enough to remember it, you can't put it into your filing cabinet.
Sure.
Language is another area, and this could be reading, writing, or spoken language, and I might not be able to find a word that I want to use or understand what I'm looking at. And lastly, there's visual spatial perception, and this is really problematic because someone is unable to understand the relationship between objects. So they might try to climb over a door threshold even though it's level with the ground. They aren't able to perceive how tall it is, and that can cause them to trip and fall.
So a caregiver has to address many issues other than just memory issues.
Yes, absolutely.
If someone has decided to be a caregiver for a loved one, what is important for them to understand from the get-go?
The very first thing I want everyone to know is this is a disease that could be with a person for 2 to 20 years. It's incurable, and it's just going to get progressively worse. And that's really the basic of it. And so if you think that you want to be a caregiver and this is a short-term thing, like it used to be for our grandparents or their grandparents, it's not that way. People are living for, on average, 5 to 10 years with this disease, so we're talking about a very long-term commitment.
What is important to do in the very beginning if your loved one is diagnosed with Alzheimer's disease?
Well, the very first thing to do is to to get together with an attorney and a financial planner or a trust officer and face up to getting all your ducks in a row, really, because there will come a time when the person with Alzheimer's needs complete care, and it's best for them to be able to have a say in what that care should be and help plan for how it should be carried out and how it's going to be paid for and doing all that. That's an important part of maintaining the control in their lives as long as possible.
And I think that would be of great comfort to the caregiver as well, knowing that their loved one is expressing their own wishes and they are able to sign documents on their own.
Yes, absolutely. Because this is a progressive disease, there will be a time when a person isn't able to make decisions and isn't able to legally sign documents.
Right.
And so taking care of this while you have as many cognitive faculties as possible is important. And families who say, well, we'll just do this later, and then never get around to it.
Sometimes you don't have a later.
Right, and they might find themselves in actually in court trying to get this sorted out, and that's very
That would be
painful
very
for
difficult.
everyone. Yeah.
I know you said then readying the living environment is so important, and you mentioned something about that you need to shrink the person's living environment. What do you mean by that?
Well, this is a person who is going to become increasingly confused and increasingly unable to interpret what is, that the space around them is really their own. And so it's important to take out things that aren't important to them anymore. So
Okay.
if there are lots of little objects that could be, that don't have meaning for them, take those out. If there's a lot of clutter, like old newspapers and books and things like that that aren't of use to this person anymore, take those out and maybe replace them with things that they can still interact with and still be engaged with.
I see. And of course, eliminating any falling hazards is so important, and we always think of falling in terms of the physical damage it might do, but is it true that the trauma of a fall can actually exacerbate this underlying medical condition of Alzheimer's?
Oh, absolutely. But people don't realize so often when they fall, they hit their heads. And when that happens, you can have someone end up in a wheelchair and not remember that they actually don't know how to walk anymore or aren't able to walk anymore and continue to try to walk. And so it is very important early on in a diagnosis to get those trip hazards out, because one of the first things that happens with some people is their gait's affected.
Okay,
Yeah.
sure. Lee, I think we're going to go on to the balanced care method right now. I know you like to use that method to help caregivers and their duties. We'll put up a graphic at this time so that you can address the 5 different overlapping areas.
Yes. This is our philosophy of care, and it's really founded in good nutrition. Because doctors will tell you that food is as important as medicine, and with this is a good foundation for helping people live the best possible life they can with whatever their condition is. And when people are often first diagnosed with Alzheimer's, they're young, they're in their 60s, and so they have a lot of energy and a lot of physical strength, and it's important for them to get exercise. And as they move through this disease, that will change, but still getting as much exercise as is appropriate for their physical condition is good. And even if it's just something like walking. You know, my parents used to play golf, and my mom wasn't very good, but it was a good exercise for both of them to be out in the fresh air. So
Certainly.
Then social ties, the next chunk of this is mental engagement. And this is really important that it evolve as the person's disease progresses, because certainly, you know, when someone's early in their diagnosis, they can do things like volunteer. And when they are in the middle stage of their diagnosis, there are going to be some puzzles that they can still work on, whether they're just a jigsaw or other kinds of things that they can still do. There are different levels of engagement that can be helpful to keep this person as mentally active as possible. And social ties is the next really important part of this. And I think it's very easy to say, well, this person doesn't know if we're here or not, why should we go visit them? And that's the last thing that is true. this is still a human being, and they still need human touch and to know that they are cared for.
Absolutely.
So
Yeah.
that's very important. And the last part of that is connected, its purpose. And so often when someone has a diagnosis of Alzheimer's in the early period, they do feel that they've lost their purpose because they may have to stop work. And so that's a good time to replace that with volunteer work as long as possible. And then as they move through the progression of their disease, maybe they can still set the table or help fold laundry or sweep. There are things that they can do to continue to be a part of the family and part of the family life.
So keep them contributing as long
Right.
as they possibly can, I'm
Right.
sure. Yes.
Yes.
I know the decision to move a loved one into a care facility is a very personal one, but once that decision has been made, how does someone handle the unhappiness of that individual, especially if they keep saying, I just want to go home?
Yeah, this is really hard, and it's really common. And sometimes people are angry when they're asking this question, and sometimes they're just sad and they really seem befuddled. And I always ask people to try to look beyond what the person's saying to what they're feeling. And oftentimes when people are saying they want to go home, they're talking about a lack of comfort. They want someone to say it's all right, and they want to feel it's all right, and they want to be in a surrounding they recognize, but because of their mental capacity, they don't recognize where they are. They don't put together they've had to move. So it's a good time to say, well, tell me what it is that is so important to you about home. Tell me what it is that you enjoy when you're home. And draw the person out and possibly draw them into a memory. And maybe they're going to say, well, I liked cooking dinner for my husband. Then you can say, well, what was your favorite thing to prepare for your husband? And if you need to use present tense because they're using present tense, then do it.
I see.
Even if you're their son, don't say, Mom, don't you remember? You can say, Virginia, I seem to recall you liked cooking Tom's favorite pork chops. And then she can say yes. And you can, well, what did he like about those so much?
Sure. So try to get that general question down to a specific.
Yes, and also into a memory that is positive and takes them puts them into that place where they feel cozy again.
Oh, sure, sure. You just want them to be comfortable.
Right.
What do you say about family or friends who offer help? Is that a good thing?
Oh gosh, yes. And it's tricky too, because sometimes people, when they're a caregiver, they think they're the only ones that can be the caregiver, and they can accept help. And so if they can get into a place where they have an easy option and a hard option, or at least more difficult, like if you were to say, well, what can you do for me? And if I say, well, would you please go buy my groceries this week or mow my grass? That's an easy option. A harder option might be, could you come and stay with my mom for an hour or two while I go get my hair cut, and I'll leave activities for you.
Okay.
You know, so have some options when someone asks you that, so that you can take them up on their generous offer.
And for those who are offering help, it's such a relief for the caregiver just to have a little bit of a respite, even if it's an hour.
Yes, it makes a difference.
It makes a huge difference.
Gives them a breather.
Yeah, that's right. If the caregiver feels a support group would help, what is your recommendation there?
Oh, absolutely. Do that, and call the Alzheimer's Association and tell them what kind of support group you're looking for. Now, sometimes support groups are more social, sometimes they're more about education. And a friend of mine doesn't want to go to a support group because she thinks her husband would not like it that she needs support in taking care of him. So she has called it her education group.
Oh.
And so it's okay for her to go to her education group.
Yes.
So find a way to make it work for you so that you get what you need out of it.
Okay, so different support groups offer different
Yes.
kinds of activities and support. So
Yes.
find the right group.
Yes.
We will put the number of the Alzheimer's Association on screen, as well as the Parkinson's disease number for support for those caregivers. Lee, our time is drawing short. I can't believe this is almost at the end, but we would like to hear your final thoughts on Alzheimer's disease and on caregiving.
Okay. The most important thing to do is to meet this person with Alzheimer's where they are and accept them where they are without expectations, because they are probably doing the best they can. And it's important that as a caregiver, you know when you have to step back from being a caregiver so that you can keep living too.
Then that's very important and so hard to do, but important. Lee, thank you so much for all of your insight today. I know that you have helped a great many people. Thanks for being with us.
Thank you.
My final segment in this series will highlight what the future might hold for those with Alzheimer's disease. I'm Kristen Stows. Please remember, it's never too late to live and learn. As I wrap up my 4-part series on Alzheimer's disease, it is my pleasure to welcome Casey Sova, Relationship Enrichment Coordinator of Home Instead Senior Care. Casey, thank you so much for being with us today.
Thank you for having me today.
Absolutely. Let me start by asking you how you found yourself in the caregiving field.
You know, I have been caregiving on one level or another since I've been probably about 19 years old. Really found my niche and my love as I worked as a hospice volunteer coordinator for about 6 years.
Oh my, so a lot of personal experience and love comes into this field. Yes, it does. When we look ahead at the future of Alzheimer's disease, what are some of the national statistics?
Well, the national statistics are quite surprising. Right now there are more than 5 million Americans living with Alzheimer's disease. Estimates by 2050 are as high as 16 million people.
Oh my.
Alzheimer's disease is the 6th leading cause of death in the United States, and it is the only cause of death among the top 10 in America that cannot be prevented, cured, or even slowed. Every 66 seconds, someone in the United States develops the disease. Almost 2/3 of Americans with Alzheimer's are women. And for breast cancer, it is 1 in 11.
I think those last 3 bullet points are very sobering.
Yes, they are.
And particularly the last one, that women are twice as likely to develop Alzheimer's than they are breast cancer.
After the age of 60.
Yes, and that's startling to me, actually.
It is.
Yeah, very sobering. Specifically then, what are the statistics that pertain to Nebraska?
Well, in Nebraska, in the year 2000, they estimated there were around 33,000 Nebraskans 65 and older with Alzheimer's disease. In the year 2010, that number jumped to 35,000, and by 2025, they are projecting there will be around 40,000 Nebraskans 65 and older with Alzheimer's disease.
My goodness. The fact that it's a 21% increase in a 10-year span, that is a lot.
It is.
It's a very large number.
It is a very large number,
yes.
indeed.
Due to the baby boomer population, I'm guessing?
We have a bunch of baby boomers joining the ranks of the aging population.
Yes, we do. When we look at developing Alzheimer's research, we see very promising advancements in developing antibodies to slow the progression of plaque buildup in the brain. And we even see eye scan techniques to detect Alzheimer's at its earliest stage. Mm-hmm. I believe you have information about research and early diagnostic techniques that are being done right here in Nebraska.
I do. In Omaha at the University of Nebraska Medical Center, there is the Home Instead Center for Successful Aging. The services that are offered there are very comprehensive. They work with geriatric medicine, geriatric psychiatry. There are various clinical trial programs that involve geriatric specific disorders. They provide a lot of community education. There's an outreach center. They have a fully equipped fitness and exercise area, as well as a wellness clinic for health screenings and nutrition services.
What a wonderful resource to be right here in Nebraska.
Absolutely.
And talk about a little bit about the use of body scans that they are doing.
Well, there are PET scans available, and what those PET scans show are plaque buildups in the brain that are specific to Alzheimer's disease.
I see. So that's very important. for anyone to know that
Absolutely.
possibly that would be a resource for them.
Yes, yes.
All of this research is geared toward diagnosing Alzheimer's disease early in the disease process to intervene with therapies before the dementia actually develops. Why is that so important?
It's important because families should really not dismiss symptoms or make excuses for the behaviors of their family members. It's just very important to be proactive and to advocate for your loved one.
Yes, I can understand that. I'm certain that once the dementia develops, also that portion is irreversible.
Absolutely, it is.
So it seems like the research is geared more to the prevention than the cure.
Right, because right now there is not a cure. There is not
Yes.
a cure.
It certainly does fall upon the patient and the family, however, to get that person in to be diagnosed.
Right.
Do you have any words of wisdom? Because that's such a hard thing to do. It's hard to ask a question you may not want to hear the answer to.
It is, because no one wants to have that news. No one wants to have that news. But I think it's very important to educate yourself. It's very, very important to advocate for your loved one, because these individuals that are experiencing this don't have a voice. So they need to have that advocate, someone promoting and cheering for them.
Yes.
I think it's also important to seek out a support group, just to know that you're not the only one out there. Because sometimes you can feel like you are out alone on an island.
Oh, I'm sure. And once that diagnosis is made, then positive steps can start.
Absolutely.
Yes.
Absolutely.
Yes. So that would be a reassuring feeling, I would think. Even though that's not what you want to hear, it helps
Right.
to know.
Absolutely.
The future of Alzheimer's care seems geared toward keeping the patient in their own home as long as possible.
Right.
Why is that so important?
Well, people with Alzheimer's disease really crave a couple of things. They crave familiarity and routine, and they crave a quiet, calm environment. So they may not be able to identify what is familiar, but it is a familiar environment for them.
Is it somewhat panic-inducing to move them to a brand new place, I'm
Absolutely.
imagining?
Because they don't know where they are. Nothing is familiar. Imagine if you were to be dropped off in the middle of a busy city in a country where they speak a different language. You would have no idea where to go, what to do, and it would be terrifying.
That's a very good analogy. Very good. Home care is less expensive than facility placement, I'm assuming?
Well, it ranges.
Okay.
The cost of facility care ranges. The cost of facility care can range anywhere from $2,000 to over $6,000 a month, depending on where the facility is and the level of care that's needed.
I see.
In-home care costs can range as well, but with in-home care, families can choose
Okay.
the amount of time that person, the caregiver, is in the home,
Right.
and the level of care as
A
well.
little more flexibility in
Yep,
the
it
costs
is.
incurred.
It is.
A couple of important points that I'd like to make. I know when we talked earlier, you said that care is relationship-based.
Yes.
And let's talk about that a little bit.
Well, relationships are so very important. All of us have tasks to complete every day. But when we have the relationship as a foundation, sometimes those tasks just fall into place on their own. What we have to remember with people who are experiencing this is their reality is whatever their most recent memory is.
Okay.
So essentially, they kind of go backwards in time. So for us to be good caregivers, effective caregivers, we have to be present in their reality, because they no longer have the ability to be present in this reality.
I think that is such an important point to make. I really do. And caregiving has to be appropriate whether it's in the home or in a facility.
Absolutely, yes. Yes.
So the caregiving is paramount importance in either place. Of course, when safety becomes an issue, then the change has to be made to a facility.
Yes.
Can we talk about how we go about doing that and how we can find appropriate placement?
I think, again, the most important thing is for families to be educated. I would always recommend that families visit several facilities, ask lots of questions, and then perhaps enlist the assistance of a assisted or senior retirement consultant like Bridge to Better Living.
Oh, that's a very good idea. Is it important to take the patient along with when you are assessing these facilities, or is it better for the family to go make that assessment on their own?
Well, I think it just depends on where that person is in their journey. A lot of times, again, taking them out of their normal environment can really cause a lot of stress for that individual.
Yes, I can imagine, and for everyone. One last topic that I'd like to talk about, and we do have time to talk about this, I'm so pleased, is the power of music in dealing with not only Alzheimer's patients, but really anyone with dementia. Why does music break through a barrier that no other method can?
Music is an international language. If you look at babies, even little babies, you turn music on and they may start to kind of move around and dance. The thing that's interesting with music is it triggers a different part of the brain for people with Alzheimer's disease.
Really?
So just finding the appropriate genre of music and things that that person enjoys, it's quite amazing what happens.
And to just bring a moment of joy and relaxation and relief to the situation. Of course, I think music can help almost any situation myself.
Absolutely.
So music therapy, that's a whole nother topic.
That is a whole nother topic.
That is so fascinating to me.
Yes.
Casey, do you feel that we're making progress in Alzheimer's awareness?
You know, I think that we are progressing in that, but I think that we have a lot more work to do. You know, we talked about the numbers, and the numbers are growing, and this is going to be affecting more people. So it's an ongoing process. And again, it's hard because no one wants to hear that diagnosis.
That's exactly right, and that's why I think we don't talk about it as much as we do. It's a tough subject.
It's kind of the opposite of the field of dreams, you know. If you build it, they will come, or if you don't talk about it, it won't happen. And we need to move past that.
Happen. I've really enjoyed having you here today, Casey. Do you have one parting word of advice for anyone listening who is either a caregiver or a potential patient?
Just be present in their reality, advocate for them, and just know that what they are experiencing is not at all what they wanted or that they intended to have any of their family members live through.
It's always the disease that you should be upset about, not the person.
Right.
Yes. I think that's a perfect ending to our segment and to our entire series on Alzheimer's disease. Thank you so much for being with us today, Casey.
Thank you for having me.
Absolutely. Again, my thanks to Casey Sova and all of my previous guests who have appeared with me on the topic of Alzheimer's disease. We are now showing on screen the website for the PBS presentation of The Forgetting, a portrait of Alzheimer's, a very straightforward film about Alzheimer's disease that tells this journey truthfully. It explains the disease process, the discovery of the disease, highlights a caregiver support group, the research being done, and the genetic component of the disease as it follows a family who is in the midst of dealing with generations of Alzheimer's. I'm Kristen Stowes. I know I have gained knowledge through this 4-part series on Alzheimer's disease, and I hope you have as well. Please remember, it's never too late to live and learn.